next we'll be hearing from Santiago Avila, talking about the readability of a radiotherapy graphic narrative patient education guide series in English and Spanish. So I'll let Santiago have the floor if he's unmuted.
Thank you so much. My name is Santiago Avila. I'm a rising third-year medical student at the University of Chicago. And today I'm going to talk to you about a translation of a graphic narrative discussion guide series known as CBRE and COGBE, and more specifically about a readability assessment of those guides in Spanish. So you can see my disclosures as well as the funding sources of the guide here on the screen. So radiotherapy is unfamiliar, complex, and anxiety-inducing for patients, as many of you all know. And to address this, we really need to prioritize accessible, patient-centered care. Unfortunately, current radiotherapy education materials for patients range from a 10th to 12th grade reading level, vastly exceeding the reading level of the average Medicaid beneficiary and defying standards set forth by the AMA and the NIH. To address this issue, a team led by Dr. Dan Golden and Professor Tomoko Ichikawa created a narrative discussion guide series for radiotherapy called CBRE and COGBE. These guides meet national readability standards and are built to be patient-centered, accessible, adaptable, and generalizable for different patients and different clinics. They aim to increase the transparency of the radiotherapy process and empower patients to serve as active participants in their care, with the ultimate goal of decreasing their anxiety before, during, and after treatment. As the CBRE and COGBE guides become more widely used, the next step was to expand access to this valuable educational resource to the 25 million individuals living in the United States with limited English proficiency. And you can see the distribution of nationally of these individuals on this slide here. Of those 25 million, 16 million are Spanish speaking. So we opted to produce Spanish translations of the series. So first and foremost, our aim was to translate and adapt CBRE and COGBE professionally into Spanish, and then assess the readability of English and the Spanish versions. To do this, 7 guides were translated into Spanish by a certified medical translator and then reviewed by a second translator for quality assurance. Translations are then reviewed and revised by a multilingual team of designers and clinicians to integrate the text into all the guides while preserving the core principles behind the design of CBRE and COGBE. To assess readability, the core text from each guide was extracted and analyzed using previously validated indices that provide grade level equivalents so that they're easier to kind of grapple with and understand. Readability analysis in English was conducted using the 10 indices you see over on the left. And then readability analysis in Spanish was conducted using the 4 indices you see on the right. Of note, LICS and RICS can be used across the 2 languages, while the Guillain-Peña Mountain and SOL indices are analogs of 2 different English tests. And we use multiple indices to eliminate biases from any of the methodology behind any of the individual tests. So here you can see the generic CBRE guide translated into Spanish. So I'd like to introduce you to Julia. Here you see Pablo and his prostate cancer journey. Here you see Belen undergoing breast cancer therapy. And then lastly, Lucas undergoing lung cancer therapy. And then jumping into the readability results, we see that across the board, the readability of the generic CBRE guide, as well as the 3 site-specific guides in both languages are currently at a 6th to 7th grade level. While there may be small differences between the English and Spanish versions of each guide, they really aren't that meaningful given that they're within a grade level of difference. So as we then look across the different indices, the individual indices, and instead group all of the guide types together, you see over on the left, you have the English guides all over the English indices. And on the right, you have the Spanish guides grouped together. As a group, the guides have a readability of 6.8 in English and 6.4 in Spanish. The Fry and Rager tests failed in English due to excessive high syllable and 6-letter words, respectively. But I should note that many must include complex words like radiation or treatment, for example, present a pretty heavy tax on these indices. So that's why they failed. This is just another representation of the readability levels of the guides in Spanish, specifically using the Guillem-Peña mountain graph. On the y-axis, we have sentence length, and on the x, we have word length. As you can see, the 4 guides are clumped around 4th to 5th grade levels on this index, but this is just one of the individual indices we use to analyze readability. So overall, mean readability levels of the guides are maintained, and importantly, the Spanish translations in their current form meet the NIH's 8th grade standard. Through iterative revisions with our multilingual team, we can work to further improve the readability to meet the AMA's 6th grade standard, which is our final goal. And of course, beyond the readability metrics we include here in this presentation, CBRE and COGBI's accessible design, the use of graphic narrative, and now the focus on linguistic and cultural relevancy can help improve access for linguistic minority patients. And I also just want to take this opportunity to note that limited English proficiency isn't the only marker here. A lot of patients that may be proficient in English may have another dominant language that they might prefer to discuss their health, or in this case, a cancer diagnosis or a treatment process. So, and then that's not something you see in census data. And for next steps, we will assess the readability of the gynecologic brachytherapy guides, COGBI, and we'll work to revise the current translations of the full series to further improve readability. And the key takeaway here is that we can standardize the process through which we can professionally translate patient education materials to help improve access for an increasingly linguistically and culturally diverse United States population. So I want to acknowledge the work of John Paul and Alicia, who laid down a lot of the groundwork for this project, and then all the help from our collaborators, Dr. Callender, Dr. Rooney, Dr. Franco, Dr. Ortega, Professor Ichikawa, and of course, Dan Golden, who have really led this in improving patient education and health literacy access. So with that, I want to thank ROECSG for the opportunity to speak and just invite any questions you might have.
Thanks, Santiago. We have about 3 minutes for questions then. Is that right, Anna?
Excellent. Yep, that's exactly right. I know we had one in the chat here from Tomas Marino. Are the Spanish versions of the guides already available for clinical use?
So not quite yet. We're going to integrate this readability assessment into our revisions, and then our team will finish editing, integrating into the guides, and then hopefully we'll have them available sometime soon.